We begin this hour with new research that highlights some disturbing trends about Canadians and alcohol. There's been a dramatic spike in the number of people, especially young adults, admitted to emergency wards over drinking-related issues. Among people aged 25 to 29, researchers found there was a 175% increase in hospital visits triggered by alcohol between 2003 and 2016. Now, that study was published this morning in the Canadian Medical Association Journal. It has also discovered some disturbing trends about women and alcohol use. Laura McQuillan has the details and joins us now. What else did this study find, Laura?
Yeah, so some really interesting details in here. This is a look at Ontario specifically, and it's not something we've seen a lot of in Canada previously, but we do know a lot more about how young people and how women in Ontario specifically are drinking now. I want to show you those numbers for women because it's pretty stark, and so men are still more likely to go to the emergency room from something alcohol related, but check this out, over that 14-year period, an 86.5% increase in the number of those visits for women compared to 53.2% for men, both going up though, and that's what's got the researchers worried. Take a look at this other number for that 25 to 29-year-old group that you mentioned. For women, 240%, that's how much their visits are up compared to 145% for men. It's really stark numbers here. It's worrying. What they did in this research is they looked at 760,000 alcohol-related visits over 2003 to 2016. That's some 480,000 patients. So some of those people going multiple times for something alcohol-related. And, we're talking about increased binge drinking, but also just people drinking more throughout the week, doing damage to themselves. And we spoke to one of the researchers just minutes ago about what they found. Take a listen to him.
So we saw presentations to the emergency department from intoxication, from individuals sort of in withdrawal, from people who had drunk enough to damage their liver, and from other harms like poisonings from alcohol. People who came to the emergency department for an alcohol-related cause were actually more likely to be admitted to hospital and spend the evening than people who showed up for just a general any-cause visit.
He also told us, it's not a trivial matter when you go to the emergency department for something alcohol-related, and it's really eye-opening. These numbers, you hear the concern from him about those serious illnesses people are suffering from. It's not just, one night of drinking, but many that are leading people to go to hospital.
It is frightening. What are researchers saying should be done to bring these rates down?
Something interesting that they included in this research was some criticism of policies of the new Ontario government, so Doug Ford's government, with those policies like buck a beer, that minimum alcohol pricing going down to $1 a beer, things like making it possible to buy beer in convenience stores, so that accessibility, they're concerned about that. Take a look at some of the comments that they included in that research. They said, there may be an increasing need for supports and services for people, especially young people, with high-risk alcohol consumption, particularly in light of recent changes to how alcohol is sold in Ontario, including making alcohol cheaper and easier to purchase. So some criticism of government at one level there, but they're saying it's not just, the provincial government, it's federal, it's municipal. They need to have more policies on alcohol access, including minimum alcohol pricing and taxes, things like restricting where you can buy it, when you can buy it, but also getting parents to talk to their teenagers about being safe when they're drinking, when they're going out, when they're getting home, and getting doctors to talk to their patients about how they're drinking and how that might affect them in the long run.
Laura, thank you for this. For more on this, we're joined now by Dr. Dr Myron in Ottawa. He's a family physician and the lead author of this study. Dr. Myron, let's start with the basics. You're talking about alcohol-related ER visits. Paint a picture for us. What kind of illnesses are people presenting with or issues?
So in this study, we saw, the wide range of harms that alcohol can cause. So we saw presentations to the emergency department from intoxication, from individuals sort of in withdrawal, from people who had drunk enough to damage their liver, and from, other harms like poisonings from alcohol.
Young people drinking and drinking too much doesn't sound like a new issue, but you found in your study some startling issues. What surprised you most?
So, going into this study, there was a very good sense that alcohol is currently causing a large amount of health problems and problems in society in Ontario. I think what really surprised us was the extent that this has increased over time, and in particular, looking at the way it's really increasing very rapidly in young adults and in women.
Why do you think it's happening?
So the study that we did wasn't designed to specifically look into causes. Speculating, I think that what we have to keep in mind is when we see increases this large, there's not going to be one simple, satisfying answer, and that there's probably a variety of different factors that are coming together to cause this. I think, again, one of several factors that could be contributing is that there's been a lot of anecdotal reports and actually no research on more marketing of alcohol to women and young people in Canada. And we actually know from the experience in other countries that this marketing can be quite effective. And I'd be concerned that there's been an increase in this marketing, which is very sophisticated and quite effective, and that may be changing the way we interact with alcohol and making us drink in more harmful patterns.
You mentioned that people are presenting with issues like liver failure or damage to their liver. So we're not talking about just a one-off, they fell, hurt themselves, had to go to the ER, but actually some lasting issues. Yes?
Yeah, well, I think the key thing to keep in mind is that showing up in the emergency department from alcohol consumption is in of itself not a trivial event. And what we found was that people who came to the emergency department for an alcohol-related cause were actually more likely to be admitted to hospital and spend the evening than people who showed up for just a general any-cause visit.
Now, these findings are specific to Ontario. What do you think about the other provinces? Could we extrapolate that they're involved too or seeing similar issues?
I would be highly concerned that other provinces across the country are seeing similar issues. I think we need to do more research to see if trends are occurring there. Keep in mind that the pattern that we're seeing here in Ontario is also occurring in the United States and the United Kingdom, and may suggest some kind of global way that we're interacting with alcohol that's not necessarily unique to Canada.
What do you think our next step should be in addressing this issue?
So I think we have to look at this from a variety of ways. I'm hoping that we can continue to have conversations as a society about how we're drinking and the ways that we're drinking. I think that we need to have more interventions within the medical sphere. And that's not just increasing treatment and rehabilitation, but having primary care providers, family physicians, talking to people about their alcohol consumption, and trying to intervene at earlier stages. And I would suggest that this study shows that maybe we need to be having more conversations with young people. And finally, I think there really is a role for government to move in with public policy. And I think that there's quite good evidence about different types of interventions governments can do, and that's at a municipal, provincial, and federal level. And I think we need a comprehensive plan on how we can reduce alcohol, people drinking alcohol and people drinking alcohol in such harmful ways.
If parents are listening to this, they may be very concerned as well, thinking about their young adults. What advice would you have for them? What could they discuss with their kids?
So I think we have to be realistic that alcohol use in Ontario and in Canada is very common. And many individuals, I would argue the majority of individuals, consume alcohol and don't personally experience the negative health impacts that we're talking about in this study. There were 760,000 emergency room visits from alcohol in our study, and that's 1% of all emergency room visits in Ontario. But it also means that the vast majority of people aren't ending up in the emergency room. I think the conversation that parents should be having with their children is very frank conversations about alcohol. In young people, we know that heavy or binge drinking is a particularly high-risk activity. And I think that having conversations about the importance of drinking in safe ways and also setting yourself up in some of the harm reduction manners that we know are so important, like having a designated driver, having plans to get home safely at night. I think that these are key conversations to have.
Dr. Myron, thank you for this.
Thanks for having me.
Dr. Daniel Myron is a family physician and the lead author of this study.